Because we've had a number of critical incidents lately involving police departments and people having mental health crises, we thought it would be helpful to have a broader conversation for families who need help and for law enforcement who are facing these crises on an ever more frequent basis, and for a bigger picture about maybe what we can do to work on possible solutions. So we've been invited here to the city of Schertz by the police chief to talk with area police chiefs about these important topics and the need for more conversations. Chief Lowry, it's your house. You get the first comment. What do you wish people knew about mental health calls that would help everybody?
Yeah, I do believe that as humans, we want to help one another, and we certainly need to understand that law enforcement has a role in that. But I would ask that you really consider the facts, and is it a law enforcement issue at that time, or is it something that can be handled by a family member, a personal physician, or if they've already sought help through a professional mental health person. So, and if that can't be resolved, then I would tell you, yes, let's get the police involved.
Right. And then when police are involved, what do people need to know to help de-escalate situations on the front end?
I would ask and tell you that I think the biggest takeaway for me is to understand that when law enforcement shows up, we truly are working to de-escalate this and have an outcome that does not involve an in custody arrest because it went criminal, or if we had to take somebody into protective custody. We want everybody to make it a win-win situation. So we'd ask that you take that in consideration and understand if an officer is forced to make an emergency detention or an arrest for a criminal episode, to understand that we're not doing that because it's a power issue. It's an issue because that was our last ditch effort to resolve this issue otherwise.
And I kind of like for everybody to weigh in on, what you wish people knew.
Well, I think Chief Lowry said it really well. I think it's important to reiterate that these can be very volatile. Let's not lose sight of that. And that certainly if they're in the area, to give us the room to operate, to give us the room to de-escalate this so we can come to a favorable outcome for all parties involved. I think it's important that they know that although not a law enforcement issue, and we are part of the solution, we freely recognize that, as we should be, we go through a great effort to educate ourselves in these areas and introduce it to the new cadets and then do our best to make the best decisions on those types of calls, exercising discretion and hoping for a real good outcome for everybody.
Right.
And to know that the officers that are going out there really do care. They care about the community and they care about what is taking place, and they do their best. And I've watched it, and I watched body cam footage and experienced it myself, and how much work these officers put into de-escalating that situation and bringing it to, an end that is peaceful and best for the patient, for the family. And I think that's one thing we understand. But there's sometimes these officers are walking into a situation that is an unknown, a 100% unknown, and they're sometimes they don't know what they're dealing with or what they're going to come across, and it's something that the community really needs to understand too. It's a very difficult situation for anybody that's walking in there, and to have the families working with the officers to help them understand what they're going into is helpful.
I would just hope our communities know that those in our community with mental health issues are just that. They're a part of our community. And I know sometimes that there can be challenges when you see those that could be in crisis, but I think that we all have to work very closely with them, better understand those in our community, and know that some of the calls that we investigate with those with mental health challenges, they're not a quick fix, right? The ultimate goal is to have that care, that compassion, get them the level of services they need, because we want them to be productive citizens in the community. And so I think it's important for us all to recognize that if you see something with that, please see something, say something, call the police out. Our officers are trained in this. We do demonstrate compassion. We believe in fostering that positive community connections, because at the end of the day, the outcome is to get that person help and back in a vibrant, thriving community.
Right. Now, you mentioned training, and that was going to be my next topic. Your officers all officers everywhere have much more training than they did historically. But a few hours of training during their course, they're still not trained mental health professionals. So that's I think people don't have a basic understanding of what happens. The officer does their best, and then at some point they turn them over to the next level.
You are so right on that, Sue. I think that, look, we have done a lot over the years to ensure that our officers are trained in de-escalation. We have, mental health peace officers now that can receive a certificate in that. But that's never going to be enough to make an evaluation. We take that quick assessment. We try to get the care for those in our community that have mental health issues. But then after dealing with that, it's left to the hospital system, right? It's for our psychologists, those with that value, with that level of care, to provide hopefully the appropriate care to get them back, hopefully not out of a manic state, and back to thriving in the community. But for us, it's an assessment. And the ultimate goal for us is to hand them off to someone who could provide greater care.
Sue, I'd like to add on that, if that's okay. After that handoff is done, I don't want you to think we wash our hands, literally, but no pun intended. I can give you instances where we probably have 400 to 450 mental health type calls a year, whether it's a welfare check or a suicide in progress or suicidal ideations or just a proactive police contact, right? Probably less than 25% of those end up resulting in emergency committal. First off, okay, so very few of them relative to the total numbers. But perhaps more importantly than that are the follow-ups that our mental health teams do. We've been out 75 times in 2024 to follow up with folks that we have committed in an effort to establish rapport, create relationships, and circumvent those types of situations from happening again.
Right. And you mentioned numbers as well. You've seen an increase in this kind of issue.
Yes, we sure have, and that's the thing. I think a lot of the departments are experiencing those increases, and with society itself, we're all facing challenges in our lives now that are very different than we did many years ago. I would say, and I think we're seeing the increases, and that's where it's really important for us to be working with with our communities, and each other, which we do, and our mental health. Doctors and are actually attending physicians, because they're really important. Once we take that person to seek help, they're probably the first ones that see them oftentimes when we do the emergency detention. And it's really up to them to allow that person the opportunity to go and see that mental health, professional, to have those conversations with them. Because in the end, we're all here trying to do the same thing, is provide a good outcome for our patient. We want to make sure that they're cared for and that they know that we're here really to help them. And we're as a society, a law enforcement society, we're going to do the best we can to provide that. But there's only so much we're allowed to do by law and by the situation. We're limited.
Right. And not only by law, but in general as a society, especially in the outlying small communities. You get a call, you call STRAC, you call MedCom, you try to decide where's the most appropriate placement for this person in crisis, and then you take them to hopefully somewhere nearby so that they can get services quickly. But there's not always a mental health care available in a lot of the outlying communities. So it's an additional challenge once they get to the hospital with the kind of person and the kind of help that they're going to receive.
Absolutely, Sue, you're absolutely correct. And there's times that we've experienced where we take them to a hospital, and 2 hours later they're already back in society or back at home, and our officers are responding a second or a third time to the same home and the same situation. And really, this is where, and I say this is where, Chief Siemens hit it. We're going back to visit these patients, these individuals, and building a rapport with them, so that when they see the uniform, it's not a threat, right, but it's somebody that they know they can trust and that they can go to if they're in crisis. And that's some of the things that we're trying to get across to the community too. We're here. It's not only our problem, and it seems like society tends to always say it's law enforcement. Law enforcement didn't do their job, but I think a lot of times it really depends upon where they're taken and who is seeing them and making that evaluation as well. We need that help.
So, as Chief Andres mentioned earlier, bringing people to the table. So, for me, it may be that the doctors don't think there's enough information that they have enough to have a further evaluation because they don't exhibit what we exhibit. So, how can we ensure what the officer writes down on their emergency detention is weighted, is done correctly, and the doctor can use that also, because people do go up and down, in and out of these mental crises, and they may not be exhibiting that, but when somebody is threatening, hallucinating, they think they see this person or this inanimate object, and they're going to kill that person that's trying to kill them. They're running out in traffic, but they're now not exhibiting that, and they say, "Let me get them." I think you need to put more weight into why an officer actually took the time to fill out an emergency detention order and use those facts. It still makes a difference, even though they're not exhibiting 2 hours later. It really does make a difference.
And that's probably one of the most important things I think I've had an opportunity to do in my career, right? I've had to sometimes go in and testify on a mental health, peace officer, detention that I actually, investigated, came in, testified in front of a judge to provide that extra information to him as to why I made the detention to take someone under a mental health peace act. And I think that's what's important because, as Chief Lowry said, sometime at the end of the day, the report's written, but what you see now with the patient, with the individual, is they're not exhibiting those manic tendencies in that moment. Well, there are times that I really would hope that we get our officers back at the table so that they can talk about what they observed at the time when they made that decision, because our officers are truly making those decisions in the best interest of that person and the community.
Yeah. The rest of you, I would just like for you to brag a little bit about your people, because the people on the front lines that are responding to these calls, they're really being put in a situation where they're having to make decisions that are probably way far above their training level, but they're doing it every day, all day, every day, right? I mean, you're finding that your officers are doing heroic things on the daily, probably.
Yes. So as Chief Seaman's numbers he was giving you, I think when you look at any agency, you're going to find similar numbers. So think about it. When you're an agency of our size, we're entering 300 to 400 welfare mental health issue calls a year, but you're only arresting 45, when I shouldn't say arresting, I'm sorry. When you're taking into protective custody somebody for an emergency detention for their own safety, you're only exercising that 16% of the time. That shows great discretion in my opinion, and I applaud my people, because absolutely they could turn around and say, yeah, you're exhibiting that, I'm not going to spend the extra time and try to see if I can get you to self-admit, you have insurance, you may have a better outcome this way, and it's going to be a negative because we do take you into custody. They spend the time. So absolutely, I think across the board, I know for these agencies, that's exactly what's going on. So I do think our people do great work. And for me, when you talk about, I think the analogy also for me would be, we talk about what training we get. We think maybe it's a lot, 3 days of CIT, and then if you go on to become a mental health peace officer, it's an additional 40 hours worth of training. We have another societal issue is shootings in schools. Do you really think 16 hours of training every 2 years prepares somebody to go into an active shooter, to be prepared when SWAT officers who do that and train for that actually are training 40 hours a month? Think about it. So I think our officers do a premier, exemplary job for the training they have. And we do expend training funds and time to even give them additional training. But yes, I absolutely will brag and say that all law enforcement as a whole does an excellent job.
Sue, to get upstream from that and to illustrate how accurate that is, and this is my plug for the profession as well, it's the most noble profession in the world, right?
Absolutely.
People don't come into this profession to make money. They come in to serve others. So let's start with a servant heart, right? These folks have a servant heart anyway. They're not out here to make an emergency detention. They're out here to solve a problem in the best interest of all parties. So they come with a servant heart. They come with compassion. And if your foundation is built on those types of things, your intentions are good. our folks are doing a tremendous job.
And the funny thing is, Chief,
And it's sweeping back the ocean, Sue, because it doesn't
if
stop.
you go to any officer and you ask them, why did you get in this profession? And they're gonna tell you one thing, and I hear it time and time and
Help
time
others.
and time again, and that's to help others, period. There's nothing else. They wanna go out there, they wanna serve the community, they wanna be there, they wanna help people. And the one thing is, I have conversations with my officers all the time, and the conversation is, and each of these chiefs are gonna have the same conversation because I work with them regularly. It's about people, and that's what we're here to do, is to serve people.
Our mission statement is excellence in service.
The bottom line, the why you do this job, because people matter. On our worst day, on our best day, we respond to calls for service because people matter. And people in our community deserve professional police services.
Absolutely.
And that's what you get every day. I know the officers in Cibolo show up each and every day with that compassion because we understand the goal. People matter.
So much of this has to be about relationship building, because somebody who's having a mental health crisis today, they're not going to be fine and dandy tomorrow. The odds are high that they will be a frequent caller, frequent flyer. And so much of this has to be about relationship building between individuals, right?
Our calls have gone down to those homes that used to be the frequent flyers, as you mentioned. Our calls to the revisits and establishing those relationships, they have decreased to those homes that have been a big demand on our resources in the past.
And so I'll step into that even more. We have people that the families that will call us directly and speak with us, and then want certain officers to respond out to their call because their family members experience the professionalism of one officer or the two officers. And I'm not saying we're just limiting it to one, but they feel so comfortable calling that individual that they will reach out for help, and the professionalism, the care that officer shows. And this is not just one officer, this is many officers that we have on our departments, spread out. It does reduce the number of calls we're experiencing, but showing that these officers really go out there and care. I mean, for them to call, I get phone calls from citizens. They'll call me and say, "Hey, we're having my son is having a mental crisis. Can you send Officer so and so out to my house to have a talk with my family
Yeah,
member?"
Tom's off his meds today. We need some help.
Yeah.
Yes, and we have that often. I mean, each one of us get that.
Worth noting, Sue, there's legislation. By the way, I'm the ACOG region's affiliate to the Texas Police Chiefs Association, one of the executive board members at the Texas Police Chiefs Group.
Tell people what ACOG is.
It's the Alamo Area Council of Governments. It's the 13 county region that makes up Bexar County and some of the adjacent counties. And I'm our affiliate for TPCA, and as one of those reps, I spend a lot of time at the Capitol, as we all do, getting legislation done, meeting with our legislators, and several of the legislations that are a priority for us as a profession are mental health related, to include providing, I guess, the statutory authority, if you will, for fire department and EMT and medical professionals to do an ED in the field as well, instead of just police officers. Recognizing that we're not the only ones that can see when someone might need help, and through the same training or similar training we're getting, the other first responders should be able to make that same, discern that same type of, come to that same conclusion rather, and help these folks out as well. So.
I'm not sure if you're familiar or not, but under statutory authority, there's only two people that can fill out an emergency detention order. That's a physician or a law enforcement officer.
That's it.
Currently.
And a lot of times, this is something we've experienced too, is some of the physicians are not filling out the paperwork. And what they do is they call, and we've had several instances where we get called to a medical facility, and we're asked to fill out the paperwork when that physician actually has the same authority we have to fill out the paperwork for an emergency detention. So it was,
I think the key though is what we're talking about. Look, at the end of the day, the community policing officer understands their community the best. And you have to have that wraparound service. And so, when our mental health peace officers are going to conduct follow-up visits, it shows that level of care. It's checking in on those in the community to make sure those in the community know that the police officer, we absolutely want to make sure that they are taking any appropriate medication they need to take. Make sure that they know that we are here to make sure that they remain vibrant people in our community. And then when there is the need to get them services and care, that we do that as well. So that is a task. And I think it's a giant task for police. I think that we have to think more globally as communities across, not just in Texas, but across this country. But I would love to see Texas lead that type of training, lead that type of sitting down at the table to find better ways and outcomes for responding to those with community, in our community with mental health crisis.
You mentioned the legislative level. Is there anything else going on in the legislature that people need to be aware of or be advocates for?
And specifically in the mental health? No, I think just that they're primarily looking at who has the authority to make an emergency detention and help relieving some of the demand on law enforcement in that regard. However, I still think we'll be making a lot of those calls. I really do. I think that we'll still end up at those calls, even if we're not the only ones with that authority, us and positions, as Chief mentioned.
And we're not saying that we should not be involved.
That's right. No, that's right.
We're not saying that. We just think it helps when that other professional in the first responder world sees that act or what that threshold is met that says somebody's having a mental crisis, if they can write it down themselves, so we're not reporting it third party.
Right.
Right.
Exactly.
Well, maybe we need to back up just a little bit and talk about the nature of emergency detention and what that really means and what the threshold is and the difference between you run across somebody who's having a mental health crisis and they agree to go voluntarily, they check themselves in, but that means they can check themselves out. And what's the threshold that they have to meet before somebody really takes a more definitive approach and says, no, you need more help than you think you do. You're going to stay with us now.
Yes.
So there's a few triggers, but succinctly stated, it's if they're a danger to themselves or others. It's a very subjective threshold, right? However, this is where our officers' training and being true public servants comes into play. We're not trying to force one, right? We're trying to come up with the best decision, be problem solvers. So in discerning, are they a danger to themselves or others? It's very clear when someone is attempting to commit suicide in many instances. In others, it's not so clear. And you have to have dialogue, you have to engage them in conversation. You have to see around corners sometimes, right? And make a really good decision in the best interest of all there. But there's other thresholds, like if you have a relationship and you can see that they're decomping. In other words, they're unkept. Their hygiene has failed. They're not eating appropriately, right? There's a couple of other triggers, but succinctly stated, it's are they a danger to themselves or others?
And I think that's where it's important, as you said. So, I mean, at the end of the day, if you are voluntarily, right, going in and having an evaluation, sometimes it's even tough on a physician because they are also observing what they see in the moment. And if that person doesn't give any of those indicators that they're a danger to themselves or others or not taking care of themselves, it makes it difficult for them to say that, hey, you need to stay. And so many times it is for the police officer, they're in our community, so we see them more often. We have a lot more information, even though we're judging that on the time that we come in contact with them. It does make it tough for someone when you see them in the moment for the first time, and maybe they're not exhibiting those statutory requirements that would require emergency detention.
I want to make this crystal clear. Every person, and applaud them, who has the courage to step up and say, I need help, and does a self-admittal, I don't want them to stop. I don't want them to think that they can, but I would present to you, generally as a rule, within 48 to 72 hours, they're evaluated. Then if that professional medical person gets to then see additional information and articulable facts that says, oh, this really doesn't need to be a self-admittal, they can change that. So yes, it may change, and I'm not telling you it needs to change, but I still think it is a big step for a citizen in need, a mental crisis situation, that they have the courage to step and say, I need help. So we don't want to stop that. So self-admittal.
No, we want them to call. We do. We all want them to call and seek that help that they need, and we are here to help and facilitate that help. But
and you should be able to check yourself out
That's
if
right.
you haven't exhibited any additional
Correct.
characteristics or thresholds that the medical professional is going to get to observe.
Yeah, you should have the right to change your mind if you're not.
So we're talking about continuum of care and encouraging people to get the care that they need. And so as we wrap up this conversation, what haven't we talked about that needs to be said? It's your house. You get to talk first.
Oh, you're going to give me the honor every time, I see.
It's your house.
Again, I think we've more or less have hit all of it. I do want to applaud the work done by our men and women in law enforcement. I do think there's great work being done. There are certainly opportunities, and when I say opportunities for our stakeholders, I'm not pointing my finger at anyone, because we have as much at stake in this, when I say we, law enforcement, as everybody. But I do believe the opportunity is there to make some differences by opening conversations and bringing people to the table, as Chief Andres has indicated that we really need to do, because it is an all hands on deck societal issue, okay? I think that we're working with our legislation through our TPCA, our local Chiefs Association. Those are the things that I think that we need to be working on.
And working with each other too, because you
absolutely.
guys have a team
A
here.
lot of collaboration in this area of Texas, no doubt about it. And I think that transcends the state and the country as well. That in general, cops want to help other cops and have good endings, right? I would like to add this. Everything he said, our folks are doing a tremendous job. I encourage folks to call and reach out for help as well, and that I applaud them as well for doing that. I would also like to remind my colleagues and other leaders, we have to take care of our own too. We can't lose sight of our own folks. They get exposed to this stuff at a tremendous rate, an alarming rate, and we lead the country in divorce rates. This profession does. Divorce rates, chemical dependency, high mortality rates. In other words, we rarely see retirement, and suicide rates per capita. And so I think it's important that to recognize that we can't do our best for others if we don't make sure that in-house we're taken care of. So we have folks that are peer-to-peer network folks now too, to help ensure that our folks are staying healthy, and so that we can give our best to others.
A recent tragedy is the Houston story, where the 4 officers have committed suicide within a very short period of time. Number 1 cop killer in America is suicide.
That's right.
And actually, there's statistics now, and I just heard this the other day, where we're actually leading the country in suicide rates. It's
We,
law
Texas,
enforcement. It's
or we law
your
enforcement?
country law,
Yeah.
in general now, we're leading. And there's some research that just had to come out. I heard that the other day.
And that's I didn't mean to cut
My
you off,
point being,
Bobby.
we can't give our best if we're not at our best, right? So we've got to look in, we've got to make sure our folks are well too.
That's one of the key elements of 21st century policing.
That's right.
It's
I
one of the
think-
6 pillars.
I think you hit it though. What's left to do, right? Continuing conversations.
Absolutely.
We're not going to get out of how we help those in our community with mental health issues without continuing conversations. Having the right stakeholders at the table, making sure that we're talking about that level of service, continuing to train our officers because they're truly compassionate about wanting to help those, but also sitting at the table with the other stakeholders and understanding that if we make an assessment and someone makes it back in the community without having the right care, sometimes it's very difficult for a police officer when they show back up there to get care. Sometimes it's difficult for the community to even think that there's someone trying to provide adequate care. And many times we have to go back in the community, explain that we did our part, right, statutorily, and that individual is back in our community, and sometimes it seems as though, did that person get the appropriate care? So we got to sit at the table. This is a conversation we have to continue to have, much like in law enforcement with everything that we're doing. It's now something that is at the top of all of our agendas as police chiefs, how we care for those inside the department, but more importantly, how we're providing service for those in our communities that are suffering with mental health challenges.
And I think it's important to people everywhere, whether they have, everybody probably has somebody in their family who has mental health issues.
Yes.
Yeah, and so it is a universal phenomena that people want their own person to be as healthy as they can be. And I also believe, because I'm out on the streets all day, every day, that people want police officers to go home at the end of every shift too, right?
Thank you, sir. Yeah, we do too.
Thank you.
Thank you.
So I think that that's a good place to wrap up. And let me just say that after this conversation, we know that there's plenty more information out there in the world. And so as a companion piece, we're going to add a link to a little documentary. It's about 5 or 6 minutes long. It was produced by the folks at STRAC. They're the overarching umbrella organization that helps lead people into this continuum of care that we've been talking about. It shows examples of what happens from the time a person is contacted on the streets till the time they get care, and what happens after that, and the types of resources that are available, the money that's at stake, the thoughtful, caring process that has gone on for years to create the best possible system so that the dialogue can continue. So we're going to put a link to that. I hope you enjoy it. I hope you stick with us. I hope that you've learned something with this and that you'll add your voice to the conversation, because we all matter. We are San Antonio's own, so are you. Stick with us for the rest of the conversation. Feel free to get involved. Sue Kalberg, KENS 5.